Distinguished guests, colleagues, ladies and gentlemen, I'd like to welcome you to Singapore to join us for the second day of the 7th World One Health Congress. My name is Jonas Karlström, and I represent the SingHealth Duke-NUS Global Health Institute, and I lead the Congress Committee. We are proud to be hosting this event, which brings together scientists, policymakers, program managers, and students, all supporting the One Health agenda. We are happy to be reporting that during this World One Health Congress, we will have more than 66 countries represented in person. I'm sure many of us are pleased to be meeting in person after what has been a difficult 2 years. The COVID pandemic has made the work you're all doing at the interface of human, animal, and environmental health even more timely and even more important. I would like to highlight that in an effort to decrease barriers to access for this event and to promote greater engagement around the One Health discourse and collaboration opportunities, this is a fully hybrid Congress. We have more than 1,000 delegates who have registered to attend through our virtual platform. And I would like to extend a special welcome to all of you joining us online. Please also take note that there are QR codes around the venue for a scannable e-program which outlines our schedule for the day, as well as a clear outline on the room allocation. In addition, there's QR codes to access all of our abstracts for the presentations, as well as the posters. And it will later also be accessible through the Congress website. We have a packed agenda this morning, and without further ado, I would like to introduce our first speaker. Prof. Wang is one of the world's leading scientists on zoonotic disease, bat immunology, and pathogen discovery. He's a professor in the program in emerging infectious disease at Duke-NUS Medical School and the inaugural executive director of Singapore's National Program for Research in Epidemic Preparedness and Response, PREPARE, fondly known to us as Batman. Linfa will be speaking on the science and importance of tracing SARS-CoV-2 origins. Please, Linfa.
Thanks, Jonas, for the introduction. Yes, the title is on the really importance in the science of tracing virus origin. So I just start with some of the conflict interest declaration. That throughout the COVID-19, I have been involved in, quite a few discoveries, and now we have a company specialized in coronavirus. And I was on quite a few committees. So I want to declare that, I'm speaking at a personal capacity, not representing any of the committees. And I was the chair of the Scientific Advisory Board for Wuhan Institute of Virology. Obviously, this is a very important institute in this context. Last but not least, I also like to declare, as the chair of the scientific committee, I did not select myself for the keynote. Actually, I insisted, committee members should not be the speaker. But the committee think that the topic is important enough for this conference. They think that, I'm the best speaker, but also I think the real reason is that I'm free, so I'm already in the country. Okay, so I have been interviewed on this topic for at least 100 times in the last 2.5 years. So I have lots of questions to myself and from the journalists. So that's what I'm going to do today, is to pose the question and try to get the best answer, I think it's most appropriate. Nowadays, 2.5, 3 years later, people basically, why bother? Why we're still hinging on the virus origin issue? But I think that, it's really important, not only for science. Origin really will teach us the early transmission event. So if we want to prevent and mitigate future outbreaks, we have to know exactly how that started. So personally, I have the fortune to collaborate with many of you in the audience, and it's really 25 years exactly, quarter of century, I've been involved in investigating really the virus origin and transmission of many of the zoonotic virus, and all of them really using bat as origin. So I'd like to really introduce the concept of ancestral virus versus the outbreak or the progenitor virus. So in this diagram, as you can see, we start with the Hendra virus in Australia, And we first detect this, from horse and human fetal cases, and then eventually we trace back the bats as a reservoir, as ancestor viruses. I just want to illustrate, use the handivirus, to illustrate how important it is to really nail down the origin, the early transmission event, and then the government and the public agency can devise effective prevention strategy. So here we're talking about the handivirus, the genus that we named. And so the first case is a handivirus outbreak in Australia through horse to human. And now we have Nipah in Philippines, the same route. And then we have the pigs and the direct transmission in Bangladesh, we believe. So let's start with the handivirus in Australia. So we know that the horse play an intermediate amplifying role. So instead of, as some politicians say, just bomb the bats, which is totally non-practical and non-scientific, we actually use the approach, what we call the One Health vaccine approach. So we develop a vaccine against horse, saving the horse because the case fatality is 70% in horses. But equally important is to prevent transmission to humans. Okay, so this is the Australian situation, and that was very fast-tracked, and the vaccine was licensed as the first really licensed vaccine against any biosafety level 4 agent. And since then, we have not had a single human case. So the vaccine has been used for the last 10 years already. And the same concept now is being contemplated for the MERS coronavirus, to prevent the transmission from a camel to human, and then a camel vaccine will be kind of attractive. Now you go to the Nipah cases, then in Malaysia and then in Bangladesh, India, there's two different cases. In Malaysia, we believe that it's the coexistence of the fruit farming and the pig farming caused the transmission of the virus from the half-eaten fruits to pig and eventually transmit to human. Whereas in Bangladesh, we think it's the palm date sap, that harvest and drink is it's kind of no intermediate animal involved, but still it's indirect transmission through the sap. So in Malaysia now it's clear the policy is you cannot have fruit farm and pig farm on the same site, and just that one simple policy change, I think so far we have not had a second outbreak. Whereas in Bangladesh, the sap, the fresh sap, and then we know that have evidence that it's a transmission through fresh sap, and you drink. And so over there they have invented quite some kind of very smart but a very cheap approach using bamboo or plastic cover, and that alone basically also reduced the cases. Human is identical, and we fulfilled a cost postulate within days. But it took 2 years. Human field is in the audience. Human play a very important role to trace back to bats, and that was involved in serology testing of over 40 wildlife, and eventually we zoom onto bats. Then you go to the other extreme, the Marburg Ebola virus. It took 10, 20 years even to find the intermediate host, and it takes another few decades. So what I try to say is virus origin studies is always retrospective by default. And for SARS-CoV-2, it's 5 days, basically, the Wuhan Institute of Virology was able to prove that virus have a very close ancestor from bat samples, but yet we are still working on, the animal X and also the progenitor virus, where it's from. So then I think the question is the origin, right? Is the virus originated in Wuhan? So what most people, at least the layman says, how can you have a virus origin from a different place and then still get an outbreak? So I will give you a very classic example. I went to California to do my PhD in 1982, right in the beginning of the HIV outbreak. As we all know, the human outbreaks start, in USA and New York and San Francisco especially. But it took, a lot of effort, international collaboration to zoom in to say the first jump, animal to human, happened far, far away and a long, long time ago in Africa. So that's a very clear evidence to say you don't need to be the same city or same location to have the human outbreak or the virus origin. And then scientifically and otherwise, what's the best approach really for virus origin investigation? And that's the reason maybe they asked me to give a talk, because I have been involved in many, many of these investigations. So I would say there's two things. One is scientifically has to be multidisciplinary and One Health, right? That's the topic. Secondly, equally important, the virus origin study is more than anything else, we need an international transparent collaboration. So I just will give you some kind of personal reflection and also the examples on this. So in terms of a scientific approach, there are many, right? Nowadays, especially the young scientists in the audience, you're a fan of NGS and the PCR. I said I'm a little bit old-fashioned, but I really think serology is actually the most important tool in this kind of study to find what I call the first hint. During Peter Daszak's presentation yesterday, I think Dan questioned serology is not as precise science as NGS. Yes, but it's much more sensitive. What we're talking about is give you a hint. Then you follow up with longitudinal sampling and the molecular test. So in 6 of the viruses I have been involved, 5 of these we already have documented, published data to suggest serology play a very important role, not only in identifying the reservoir species, but also early transmission event. And then for COVID-19, although we still have not discovered the animal X for the progenitor virus, but I will show you that serology has already played a very important role in all aspects of research, including vaccine efficacy, So what I'm going to give you, one example that we did in serology is to prove the other way that, when MERS coronavirus emerged, as a human disease in Middle East, camel was the one identified as the animal X, and the virus over there was very close to the human virus. The question is, where is the ancestral virus? And people like me think the ancestral virus is from bats, but most people are thinking maybe it's just camel is the natural reservoir. So in Australia, we had a unique situation. In Australia, 150 years ago, camel were imported really to use as a tool for farming and transportation. So we know there's a line. 150 years ago, the camel came to Australia. So we did the serology in the camel population in Australia to see if the camel in Australia also containing antibodies to MERS coronavirus, and the results were clear. Clean, absolutely. We sampled 4 different populations in a wide geographic location. So that really is, I think it's an interesting example of use serology to do virus origin study, but in the reverse fashion to say camel 150 years ago were clean of MERS coronavirus. Okay, now I'm talking about how important is the international collaboration, the transparent collaboration. So I was fortunate enough, John McKenzie in the audience was chairing the scientific advice board for WHO. So this is the last mission for SARS-CoV, during the outbreak. The mission is to investigate the origin of SARS-CoV and the early transmission event. I have to tell you that the situation was very different from the mission last year for SARS-CoV-2, For SARS-CoV-2, the mission was surrounded by politics and all the media paparazzi. For us, when we went to China, there was no media. We had to invite them to the WHO office to update the media. So this is a joint mission, and I said that John McKenzie was behind that. And this is 8 of us. Hume Field is in the audience, myself, and Betsy Miranda is in the audience. 3 of the 8 are in the audience, represented, 2 from Australia, 2 from France, 1 from USA, 1 from Japan, 1 from Philippines, and 1 from Hong Kong. So it's conducted in a totally transparent, apolitical environment, and we were able to access everything, every lab, raw data. We even went to their military institute in Beijing. And I really like to highlight the composition because Anne Schuchat is from US CDC, and she has a military title, actually, So in COVID-19, she, is played a very important role. So I think I just, want to emphasize that is in 2003, and then in 2021, that's unthinkable. And then just to demonstrate, then 18 months later after the mission, I coordinated the international consortium. Now Peter Daszak, John Epstein, are in the audience. So this is a 5-institute, 3-nation collaboration, totally seamless, totally transparent, and we can move material around. Of course, with the proper export and import permits, but at least we can do that. And today, I think that's just very, very difficult. Okay, so we eventually nailed down to say that it's from bats. But if you read the title, we said bats are the reservoir of SARS-like coronaviruses. This is about the origin of the ancestral virus. To this date, I don't think we have a clear evidence how the progenitor virus moved from civets to human. Civis obviously is not the natural reservoir. So to this date, I'd like to remind the audience, we still don't know the natural reservoir of the progenitor virus of SARS-CoV-1. That's just how difficult it is, and I just want to emphasize that. So the origin, now we move very quickly to the origin of SARS-CoV-2. Of course, it's I'd like to introduce the concept. We're talking about the origin of three things: the human outbreak, the etiology reagent, and now Omicron. Okay, so three all interesting and that represent different. And technology, so our lab developed this surrogate virus neutralization. Without being biased, I think it's very important for the test. On the left is a classical virus neutralization, mix the antibody with the virus, and we engineer the protein now become ELISA-based, and basically it's 30 to 50 minutes. And with this technology now is a species independent. Same assay has been used in many, many different animal species. I lost count. I think it's being applied for 20 different animal species, and the highlight mink and the white-tailed deer are the important ones. Since the emergence of the variants, we realized a single assay will not do it, so we transformed this into a multiplex assay. Now it's greater than 20-plex. So with 5 microliter of serum of any species, including human, we can do a very precise neutralization against 20 different cybercoviruses. So I start with the outbreak, the human disease outbreak. I think it's beyond any doubt, you start in the Wuhan, the seafood market. I mean, the seafood market is a misnomer. It's a market with live animal trading as well. So Mike Warby and many sort of authors published this with a very convincing evidence. In the market, you have the east side and the west side. The east side is doing the frozen seafood. The west side is the mammalian product, including live animal market. As you can see, the stores that sell the mammals are where the human cases are mostly associated. And the environmental samples are with 4 of the SARS-CoV-2 genomic material, and the 2 samples even provide the virus isolation. And the origin of SARS-CoV-2 is the most difficult and also most controversial. So again, as I said, it's almost like the old topic. And then more than a year ago, John Cohen from Science organized this online streamed discussion or debate. So for those of you interested, you can watch this online. I'm not going to go to many of the details. But I think it's important, in this kind of, even in this online, John titled this lab leaker versus natural origin. I think that we have to define what lab leak means. I think it's more appropriate is the man-made versus natural origin. Initially, there was a hypothesis this virus was engineered. So then if it's a man-made virus, there's 2 ways of intentional release or a lab leak, accidental leak. But then we have the natural origin, right? So it's a natural origin, but leaked from lab. Now there's a terminology called a research associate. That means the virus has never reached the lab, but the scientists in the cave were accidentally infected without the knowledge and then brought the virus to Wuhan. And then the third, of course, is the animal trading related. That's the, so the man-made hypothesis have 3 kind of arguments. One is that it started in Wuhan. So this basically is almost association, guilty by association. Secondly is to say the SARS-CoV-2 spike by the human ACE2 better than SARS-CoV-1. And then thirdly is to say that, it has a fusion cleavage site. So I think the second one now, we have the virus from Laos. The ACE2 receptor binding is as good. The IBD domain is very close. And for the fusion cleavage side, there are many papers out, but I thought I cite the paper by Johnston and Felix. Basically, I think they demonstrate that all you need is a few point mutations. These are all backbone SARS-related coronavirus. So through the current known mechanism, you can get it. So they supported the natural origin. And then the Omicron is interesting. It's under our eyes, under so many GSET sequences, and we still miss really how that originated. So there's the human versus the animal origin again, and the support for animal origin basically says Omicron has rodent, binds to the rodent ACE2 better than ancestral Wuhan virus. But I think, what we have provided recently is that we did this surrogate virus neutralization. So on the left panel is the different viruses. From left to right is the mutations that contained in the spike protein. So as you can see, the Omicron has less mutations than the pangolin and the bat viruses, yet they have more potent, evasion of immune response. So on the right, we play the blue curve is the animal cybecoviruses in terms of their ability to evade the immune neutralization. And on the x-axis is the number of mutations in the spike protein. As you can see that clearly that the human variants evolve much more. So it's under immune selection. And then this is many of the papers published, and this is from Germany, basically. I think most likely is from immunocompromised patient. They have persistent infection. So in this particular one patient, 7 months, they isolate 17 different spike mutations, and 11 of them actually share the same mutation as the Omicron. So we don't have the exact kind of Omicron origin, but I really suggest it's evolved under immune selection. So I'll finish up really to say, are we ready for SARS-CoV-2? And that's what Peter Daszak yesterday proposed that. So I think, in terms of the future risk, there are three. I still name wildlife animal trading number one. Human-animal human transmission, the reverse zoonosis now is number two. And then evolution and the immune selection in human population is number three. So Peter already says, 14 million employees in China alone working on wildlife trading. So that risk factor is much high. These are my personal photos. Hume is in the photo I took during our mission to Shenzhen in SARS-1 investigation, So, and the second is the spillover versus spillback, right? So we're used to the zoonotic spillover, human to animal to human transmission, but SARS-CoV-2 now really pose a challenge of the reverse zoonosis. These were the slides I prepared in the middle of 2020, and I still believe that's, we have to watch out. I still believe that SARS-CoV-2 originated from bats in Asia through animal X, and then we have a massive human-to-human transmission, and mink, and then to that. So mink is farm animals, it's not as bad, we can contain it. So we're worried about what happens if we go to wildlife, like bats in America, it's not natural reservoir, become unnatural. So then it goes to animal X, Y, Z, and then come back as SARS-3. So unfortunately, Kevin couldn't make it. He led this review paper for pathogen. We were really looking at the bats in, different world and to see that as a case of reverse zoonosis. But then the white-tailed deer, many of you in the audience already know, using our CPAS serologically that they indicate that high percentage of white-tailed deer in US is already infected, multiple lineages, and most, worrying is asymptomatic. That means it's already a natural reservoir by definition. And then in terms of Omicron, we lost track already. There's from BA2 in the last half year, there's so many variants and many more is going to come. So in summary, I think the virus origin is an important scientific research topic, and best approach is in a One Health strategy, but can only be addressed with international collaboration in a apolitical manner and environment. I'd like to thank my team. This is the last happy photo we had, 2019 Christmas. And ever since that, they were not smiling like that. They work, 48 hours a day and 7 days a week, So I have lots of collaborators. I'm not even going to name names, and many of you in the audience. And I thank you for your attention.